I had a really hard time for the longest time thinking somebody else died in order for me to live. But, it's what you do from here and moving forward. My name is Melinda. I'm a registered nurse at ThedaCare, and I am a heart transplant recipient. I always had an interest in the medical field. Caregiving and being part of people's lives were something that I wanted to do. I graduated from New London High School in 2007, so it would have been like November of 2011. I started having heart palpitations. I started having weird feelings in my chest, and I started not being able to sleep. I started kind of getting hot flashes, and I was like, this is kind of weird. I felt like I was gonna pass out, and I remember the dean walking through, and she was like, "Hi, Melinda, good morning." And I was like, I couldn't even really say good morning, and I just smiled and waved at her. I made it a little bit farther down the hall, and I just passed out. They wanted to take me to the hospital. They ran tests, and they told me that I had heart failure. He called down to Freighter, had my pacemaker put in, everything was going good. I graduated from nursing school May, June, and then July I started going downhill. I went from 210, 215 pounds down to 150, and at that time I had less than 15% of my heart function. During this whole time, I started dating who is now my husband. Before my first open heart, which was my LVAD, he had proposed to me in the ICU, and obviously I said yes. They ended up transferring me from Freighter down to Chicago. I didn't really have longer than 48 hours to stay on this LVAD. I would get my LVAD exchanged, I would heal up, and then when the time was right, I would then be listed for a heart. Back then, you get a kind of a free 30 days at the top of the list. That night, I would have been out of time, and I got a phone call at 1:51 in the morning from my cardiologist, and he's like, "I called to tell you that we have a heart for you." I just didn't believe it. And he's like, "Melinda, I'm serious." He goes, "We have a heart for you." I had 3 open heart surgeries in 5 months, and then it ended with my transplant. I graduated in May of 2012 with my BSN, and then once I got my LVAD in September, I started applying to the state to take my boards, and the state of Wisconsin told me that under no circumstances can you bring anything in with you. My donor passed away on Valentine's Day. I always do things now around February if I can. Just another reminder of being thankful and grateful, honoring my donor the best I can. And so I ended up taking my boards on February 5th. I ended up passing. I found out 2 days later. My first official day in training here, there was a donor walk. It was like that closing chapter to my book. I was meant to be in this system. I really can genuinely understand with people when they say that they're tired of being in the hospital, or they're in pain, or they miss their family. I always give them little tidbits of things that helped me so much as a patient. You just have a little bit more empathy for them and a little bit more understanding. And I think that's something that I can really bring to my patients.